The best gaze item, number 2 on the NIH stroke scale, tests voluntary horizontal eye movements. Disorders of vertical gaze, nystagmus, and skew deviation are not measured. First, look at the position of the eyes at rest. Make sure to note any spontaneous eye movements to the left or right. The next test is to move your finger or other target horizontally, asking the patient to track your finger from side to side by moving the eyes only. Make sure to keep asking the patient to follow the target. If the patient does not accurately follow your finger, a stronger test is needed. Use the oculocephalic maneuver, eye fixation, or tracking of the examiner's face. This is an exception to the rules of using the first observable response for scoring and not coaching the patient. In patients with poor attention spans, establish eye contact and move your face around the patient from side to side. This may clarify the presence of a partial gaze palsy. Now I'm going to test your gaze. I'd like you to look at my finger and follow it all the way over this way and all the way over that way.
For scale item 2, this patient scored a 0. Let's look at how this scale item is scored. Score a 0 if the tasks are performed correctly. If a patient has ocular rotary problems, such as a strabismus, but leaves the midline and attempts to look both right and left, the patient should be considered to have a normal response. Score a 1 for partial gaze palsy.
I want you to look at me, look here. Now I want you to look over here. Look over here. All right. I'm going to help you out here a little bit so we can see your eyes. I want you to look over here. Now look over there. Okay?
If there is a conjugate deviation of the eyes that can be overcome by voluntary or reflexive activity, also score a 1. If the patient has an isolated cranial nerve paresis, such as an oculomotor or abducens palsy, also score a 1. Score a 2 when there is forced deviation or total gaze paresis not overcome by the oculocephalic maneuver.
I'm going to test your eye movements now. I want you to look at my hand. Can you look all the way over to your right? Look at my hand. And then look all the way over at me. Look here at me. All the way here at my hand. Good.
If there is a conjugate lateral deviation that is not overcome with reflexive movements, the score should be a 2.
The easiest way to score this item is to consider whether the eye movements are normal. If so, score a 0. If not, consider whether there is tonic deviation such that the eyes cannot be moved. If so, score a 2. Everything else would be scored a 1. Patients who scored a 3 on level of consciousness, item 1A, are in a coma and may have gaze palsy that can be overcome by moving the head. So in these cases, you should use the oculocephalic maneuver and score the result. To keep the testing conditions standard, do not do caloric testing. With aphasic patients, gaze is testable. Just like with confused patients, it helps to establish eye contact and move about the bed. And finally, patients with ocular trauma, bandages, pre-existing blindness, or other disorders of visual acuity or fields should be tested with reflexive movements and scored. This may mean removing the bandages. The third item in the NIH stroke scale tests the visual fields of both eyes. In the visual fields item, each eye is tested independently. Upper and lower quadrants are tested by confrontation. This means using finger movement, finger counting, or visual threat as appropriate. If a patient is unable to respond verbally, the examiner should check attention to responses to visual stimuli in all quadrants, or have the patient hold up the number of fingers seen. Make sure the patient is looking directly into your eyes during the testing. Tell the patient you will be testing peripheral vision and that you may move a finger to the right or a finger to the left or both. Then you test by asking the patient to count fingers in all 4 quadrants. Patients who scored a 3 on the level of consciousness, 1A, are tested using bilateral threat. Now the next thing I'm going to do is I want to test your vision. All right? So I'm going to help you cover your right eye.
Okay.
How many fingers do you see?
2.
Okay. And
2.
how many fingers do you see?
5.
Good. And how many fingers do you see?
1.
And how many up there?
1 or 2. Huh?
Now look at me. How many fingers down there?
1. 5. 1. 1.
For scale item number 3, this patient scored a 0. Let's look at how this scale item is scored. Score the item 0 if the upper and lower visual fields are normal. If the confused or language-impaired patient looks at the correct side of the moving finger, this is scored as normal. If a patient has severe monocular visual loss due to intrinsic eye disease and the visual fields in the other eye are normal, the examiner should score the visual fields as normal. Score a 1 only if you find a clear-cut asymmetry, including quadrantinopia or partial hemianopia. If there is an extinction, score the patient a 1.
And I want you to look at my nose and tell me, how many fingers do you see out of the corner of your eye?
2. 1.
Okay, look right at my nose. Look at me. How many up there?
2.
Okay. Look right at my nose. Look at me.
1.
Okay.
2. The whole hand.
Look at me. Look at me. Look at me.
3.
Look right at my nose.
2.
All right. Now switch hands and cover your left eye for me. All right. Again, look at my nose.
1. The whole hand. 1. 2. Look like 3 or 4.
Okay. How about now?
1.
Look at my nose.
Score a 2 for a complete hemianopia.
Cover your right eye for me. When you see a finger, you tell me how many fingers you see.
1,
Good.
1, 1, 1,
All right, now I want you to switch eyes, and we'll try the same thing again.
1, 5,
Good.
5,
Good.
Score a 3 for blindness of any cause, including cortical blindness, which requires a positive diagnosis, and double simultaneous stimulation testing.
All right. Do you see my hand moving?
Yes.
How about now?
Yes.
Okay. Do you see my hand moving now?
Yes, I do.
How about now?
Yes, I do.
All right. As soon as my hand moves, you say now.
Ow.
Okay, one last thing. I want you to look right here at me. Look right here at me. Very good. If there is unilateral blindness or enucleation, visual fields in the remaining eye are scored. The result of this item will have an impact on the last scale item, extinction and inattention, and many of us check double simultaneous stimulation to visual input at this point. There is an arbitrary rule that if they extinguish, the visual field item is scored a 1, even if the fields are intact to confrontation. This rule helps even out the variations that occur when inexperienced examiners encounter neglect so severe that the patient appears to have a visual field cut. The next item on the scale is an assessment of facial palsy. To assess facial palsy, you ask or use pantomime to encourage the patient to show me your teeth. If the teeth aren't in, ask them, show me your gums. Open and close the eyes. You can say, squeeze your eyes shut as hard as you can. Raise the eyebrows or lift up your eyebrows as high as you can. The patient needs to look directly at you while performing the requested tasks. For the aphasic, poorly responsive, or non-comprehending patient, use a noxious stimulus. In this case, the symmetry of the grimace is the basis of scoring. I'm going to examine your face. So I want you to show me your teeth. Good. And now relax. Close your eyes real tight. Tighter, tighter. Very good. Now open your eyes and raise your eyebrows up. That's great.
For scale item 4, this patient scored a 1. Let's look at how this scale item is scored. Score the patient a 0 for normal symmetrical movement. Normal function must be clearly demonstrated. Orbital and forehead musculature movements are normal. Score a 1 for minor paralysis, such as a flattened nasal labial fold or mild asymmetry while smiling. This is the proper score if function is less than clearly normal. Score a 2 if there is paralysis of the lower face. This is the appropriate score for clear-cut upper motor neuron facial palsy. Decreased spontaneous and forced facial movements are most prominent at the mouth.
Open your eyes. Look at me. Thank you. Can you show me your teeth? There we go.
Score a 3 when there is complete paralysis of the upper and lower face. This is the appropriate score for the obtunded or comatose patient, or one with unilateral lower motor neuron facial weakness.
Now ask her to do what I do, to show me her teeth. Show me your gums.
Enséñale los encías así.
Good. Now close your eyes
Cierra tus ojos.
tightly. Tight.
Fuerte.
Fuerte. Tight. Tight.
Fuerte.
Good. And now raise the eyebrows up.
Abre los ojos.
And raise the eyebrows.
Levanta tu ceja. Tu ceja, levántala. La
Okay.
ceja.
Good. Good. The easiest way to score this challenging item is to first decide if the face is normal. If so, score a 0. If the face is not normal, ask yourself if there's a clear-cut asymmetry of the smile. If so, score a 2. All other findings, including subtle asymmetries of the nasolabial fold, are scored a 1. The score of 3 is reserved for the very unusual complete facial paralysis seen with some brainstem strokes. Remember to include using noxious stimuli to score the symmetry of grimace in poorly responsive or non-comprehending patients. Also, in the event of facial trauma, remove the bandages, tape, or other physical barriers that might obscure the face. Scale items 5 and 6 assess arm motor movement and leg motor movement. For motor arm and leg scoring, make sure to appropriately position the limb. Extend the arms 90 degrees if the patient is sitting, or 45 degrees if the patient is supine. Always test the leg in the supine position by extending the leg 30 degrees. You score drift if the arm falls before 10 seconds as you count down out loud, or if the leg falls before 5 seconds. Begin counting immediately at the release of the limb. You should also count down with your fingers in full view of the patient as you count out loud, so that the patient receives verbal and visual input. You can help the patient in this item by placing the limb in the desired start position. Watch for an initial dip of the limb when you release it. Only score abnormal if there's a downward drift after the dip. Each limb is tested in turn, beginning with the non-paretic arm. When testing the arms, the palms must be down. Do not test limbs simultaneously. Do not coach the patient. Only in the case of amputation or joint fusion at the shoulder or hip is this scale item not scored. But you need to make a written note of this. On some printed copies of the NIH stroke scale, you may be advised to score amputation as a 9 when scoring motor arm, motor leg, or ataxia, but don't use the 9s in calculating the total score. You'll have to use urgency in your voice or pantomime to encourage the aphasic patient. These patients may understand better what you are testing if you use the non-paretic limb first. If the patient has restricted limb function due to arthritis or non-stroke related limitations, you still need to give a score. Use your best judgment to differentiate between the effect of the stroke and any other cause. I'm going to ask you to hold this arm up right here, straight out for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's terrific. Okay. Now let's try the other side. I'll hold it up, and when I let go, you keep it up for 10 seconds. Can we get it to there? Okay.
I don't know.
Let's see. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay.
For scale item 5A, this patient scored a 0. For scale item 5B, the patient scored a 1. Let's look at how this scale item is scored. Score a 0 if there is no drift and the arm remains in position for a full 10 seconds after any initial dip. Score a 1 if the arm jerks or drifts down to an intermediate position without encountering support, such as a bed, before a full 10 seconds.
I want you to hold your arm up for 10 seconds. You ready?
Ready.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10. That's terrific.
Score a 2 when there is some effort against gravity, but the arm cannot get to or maintain the proper position and drifts down to some support.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Score a 3 when there is no effort against gravity and the arm falls.
See if you can hold it up at all. Okay. And shrug that shoulder for me. Show me that shoulder move. There we go. All right.
Score a 4 if the patient is unable to make voluntary movements.
I'll hold it up for you. Right there. Now you hold it up. 1, 2, 3, 4, and it's hit the bed now. So what I'd like to know is, can you move it at all? To differentiate a score of 3 from 4, you have to encourage the patient and wait a second or two to observe movement in the paretic arm. Any movement at all, including small proximal movements, such as shoulder shrug or hip flexion, is enough to lower the score from 4 to 3. A patient who scores 3 on level of consciousness 1A is scored 4 on this item.